Member for Kelowna Mission.
Thank you, Mr. Speaker. Well, the contrast of the fantasy that this minister promotes and the reality of British Columbians that have healthcare needs is staggering. Every day we hear stories about the collapse of the healthcare system under this minister's watch. Linda recently shared her story with me. She's a 73-year-old woman going through waiting lists. Waiting lists for a mammogram. Waiting list for an ultrasound. Another waiting list for a biopsy, and yet another one for her surgery. And after these waits, when she finally had surgery, the tumor had grown so significantly that she was now stage 4. This shouldn't come as a surprise to us. The radiologists warned us of the tsunami of late-stage cancer cases. And because of the progression while Linda waited, she now has to undergo both radiation and chemotherapy. But instead of helping to working to help Linda, this minister has put $1.3 billion additional dollars in increased administrative costs instead of frontline workers. How can the minister justify this $1.3 billion in additional administrative spending, or the 64 vice presidents each earning $400,000 each, all while Linda can't get the care that she deserves? Will he do the right thing and resign, or will he wait to be fired by the tainted premier delegate?
Members, are you interested in the answer? Minister of Health.
Thank you very much, Honourable Speaker. Every case in British Columbia matters, every single one, Honourable Speaker. This has been, as people in this House know, an extraordinary period for public health care. 2 public health emergencies that aren't even recognized in their questions, Honourable Speaker. When they ask about the health, as if they didn't exist, as if it's not there, as if COVID-19 is still not an international health emergency and a pandemic in BC, which it is, as if there aren't 15,000 people off work this week in healthcare in very significant respects compared to the average because of COVID-19, as if these things aren't happening. And in this context, Honourable Speaker, we are delivering, and Honourable Speaker, Honourable Speaker, I guess,
Members, please.
The opposition House leader is continuing to heckle. They seem to suggest that the questions are serious, and then they don't behave that way. That's fine. That's their business.
Members.
Thank you, Honourable
Minister
Speaker.
will continue.
With respect to radiology, so every case matters. And when people struggle in getting access to the system needs to respond to that. And in very significant ways, it is. Honourable Speaker, after a long period of government, we were last in Canada in MRIs, right? We've done 174,000 MRIs in the 2016-17 fiscal year. That's 174,000 people. And that seems like a lot. Last year in a pandemic was 296,000. If we were still at 174,000, Honourable Speaker, can you imagine what the circumstance would be in radiology? But we're not. And why are we not? Because we went from one MRI machine going 24/7 to 9, Honourable Speaker. We went from 4 going 16/7 to 18, Honourable Speaker. And we added 17 public MRI machines. Equally, with respect to CT scans, you know who we pay for? We pay for tech, we pay for staff who support and schedule those appointments, we pay for radiologists. Those are the things we pay for in providing that care. We've gone from, frankly, 22 per thousand in the Northern Health Authority, Honourable Speaker, it's mostly represented by BC Liberals, to more than double that in terms of MRI. That, Honourable Speaker, is a